Today I am going to talk an important topic in the field of pain. It is nothing but the physiology of neuropathic pain. We all know that pain are many in category. Some are mechanical, some are inflammatory, some are ischemic, some are neuropathic. And neuropathic pain is very common nowadays because of the rising incidence of cervical and lumbar disc bulges. It tend to compress the nerves, and these nerves themselves are diseased that causes neuropathic pain. Whenever a nerve is irritated in terms of compression or it is inflamed, there are two things that can happen. One is the nerve can gain its function or the nerve can lose its function. These two things are the possibilities. What do you mean by gain of nerve function? Have you heard of law of denervation supersensitivity? That means whenever a nerve is irritated or inflamed or compressed, it will conduct the messages super fast. That means the action potential will be so rampant that the brain will be misperceiving that as a real impulse. To make it simple, for every single action potential generated at the tissue level, the nerve which is supposed to carry the messages in the form of action potential will multiply into 2x or 3x, and that will send such a augmented messages to the brain. So that is called as gain of nerve function. For every single stimulus, there will be a multiplication of action potential along the nerve that misinforms the brain. That we call it as gain of nerve function. Now, whenever a peripheral nerve or a spinal nerve is compressed, the nerve will undergo a gain of nerve function that causes pain. Sometimes it will be extremely severe pain, like shooting pain or electric shock, or it can be even in the form of tingling, it can be in the form of ant crawling, like water running along the skin. If the same happens in the chronic level, it can cause even allodynia and hyperalgesia. Have you seen your patients, when you touch them even little bit, they feel more pain? Even though the touch is not supposed to cause pain, because the nerve is producing more action potentials, the brain will feel more pain even for a slightest touch. For a non-painful stimulus or a least painful stimulus, the nerve will make the brain to feel more response. That is called as allodynia and hyperalgesia. So if you see people who are having chronic pain syndromes, these people are having gain of nerve function in their entire spinal nerves. So they feel pain all over the body. Wherever you touch, they have pain. They will be having tenderness. Under the same category, there is one more symptom called as cold sensitivity. Even for a slightest decrease in the temperature, they feel extreme cold. It's not the problem with the temperature. Their nervous system is augmenting the messages up to the brain, and the brain is actually feeling more cold, even though there is no ambient cold present. So this is one more example of gain of nerve function at the nerve level. It depends upon which nerve is compressed. Accordingly, the symptom would be varying. If the pain fibers are generating the action potential more, then the patient will be feeling more pain. Typically in sciatica or cervical radicular pain, when the exiting nerve is slightly compressed, it will gain the functions more, so that the patient will be having more pain as a result of gain of nerve function. If the other fibers are compressed, then these patients will be somewhat feeling like water running or ant crawling sensation or even tingling and so on. So it's very hard to say which patient will have which type of symptom, but the moment you feel tingling or the moment you feel shooting pain, the moment you feel ant crawling sensation or allodynia or hyperalgesia, you know that it's neuropathic pain. You know that in the pathway somewhere the nerve is damaged, it is generating too much of action potential that is causing more augmented passage of messages up to the brain. That's the reason why some patients who are having severe neuropathic pain, they are getting pregabalin or gabapentin as a tablet, because these tablets will reduce the action potential of the conducting nerves. But there's a caveat in that. The tablet what you take in your body, it will not find exactly which nerve is compressed and go and give its effect. The tablet what you take will go to all the hundreds and thousands of nerves in the body. That's the reason why, apart from pain reduction, some people also will feel lethargic, drowsy, sleepy, dizzy and so on, because these tablets will not have a single effect. It will affect all the nerves in the body. That's why all these tablets will have other effects too. Even though these tablets are given for reducing the gain of nerve function, they don't really know the reason for the gain of nerve function. That's the reason why the medicines will be only short acting. It will be helping only for time being until the real cause is addressed. Under which condition these things fall under? The radiculitis. When the lumbar or cervical exiting nerves are compressed or irritated or inflamed, it classically comes under the category of radicular pain or radiculitis. Under radiculitis, you get all these symptoms. But again, you need to identify what is the reason for radiculitis and treat the radiculitis. The pain, the electric shock, the allodynia, these are all merely a symptom. We physios, we like to treat the pain. We just try to treat the pain, but we don't know how to treat the ant crawling sensation. We don't know how to treat the water running sensation, because it is not possible to treat this sensation compared to pain. Pain is probably managed by your modalities wherein you use pain gate theory, probably you do some manipulation or massage in order to block the pain sensation for some time, but it's only a pain management. As a physio, you need to go to the cause of the radicular pain and treat the cause, which is usually due to disc bulges, disc herniations and disc sequestrations, or even sometimes cardiac lesions. Let me talk about loss of nerve function. This is exactly opposite of gain of nerve function. When there can be a loss of nerve function, when the damage is too much, that there is no more action potential happening in the nerve, and the sensory nerve are not able to carry the sensation up to the brain. So these people will feel numbness in the index finger, or they'll not be able to feel the sensation in the sole of the feet. So this is called as loss of nerve function when the sensory fibers are affected. When the same loss of nerve function happen in the motor fiber, then you will get paralysis, weakness. The people will not be able to grasp objects correctly. These people, when they lift weights, especially heavy weights, they will realize that one arm is not as strong as the other arm. These are all the subtle signs of radiculopathy, which is already saying that there is a loss of nerve function. Extreme cases like in cardiac lesion, there will be complete paralysis. People would get foot drop, toe drop, bowel bladder disturbances, saddle anesthesia. So these are all some of the red flag signs that you need to quickly pick up and then refer for surgery. When do you get loss of nerve function? When there is a radiculopathy. What is radiculopathy? When the weakness is predominating the pain. When the nerve fibers are so much compressed that it is not able to conduct any messages due to loss of nerve function, that's when you get sensory loss, you get motor loss, loss of muscle power, and so on. These are all the extremes of neuropathic pathology. In the neuropathic pathology, there can be a gain of nerve function, which predominantly causes pain, or there can be a loss of nerve function, which predominantly causes weakness. Almost 90% of the neuropathic pains come under the category of gain of nerve function. That's the reason why most of the people are suffering with pain, but not the paralysis. And you know what? This 90% is good because it's the pain which is protecting you from getting paralysis. Pain is always better than the paralysis. As a physio, you need to decide in which category your patient is falling in, what to do for the symptom, at the same time what to do for the reason for the symptom. In other words, we call it as a diagnosis. Most of the neuropathic pains, what we commonly encounter in our clinic, is due to cervical disc bulges or lumbar disc bulges. It can be disc herniations, it can be extrusions. Different people will have different pathology, but most of this disc pathology will disturb the nerve, the exiting nerve. It can be a sensory nerve, it can be a motor nerve. Accordingly, the symptoms do vary. I believe you have understood something about neuropathic pain, which is the common types of pain that we encounter in our patients who have got sciatica and cervical radicular pain. They all fall under this type of neuropathic pain. So think in a sciencey way, do in a sciencey way.